I'm going to welcome you. On behalf, we are 3 moderators with myself, Jason, and Jonathan. And if you're in this room, I would like to see if anybody dares raise their hand with my question, which is, are you not involved in social media yourself? Who here has no relation to controlling any social media account? Okay, so now everybody who does have a relation to a social media account, please raise your left hand and raise your right hand and take a deep breath and let it out. And now we're going to have fun because this is a patient-included conference. And how could you do a patient-included conference without using social media for prevention to keep them from ever becoming ill? And with that, Jason.
Hello, everyone. Now, you've probably heard me talk about the idea of predictive value of infection prevention control. So we take all sorts of data, and we put it all together, and we can predict something. And all of a sudden, we're swamis and yogis who know the future. Well, I'm about to tell you a couple things about the future. One, it is going to become more interesting when it comes to infection prevention and control. 2, social media is going to have a greater influence as we move forward. And 3, our next speaker, who's going to be talking about the use of social media in the ability to predict infections, will himself disappear like pandemic flu did. And I predict that will happen in about a half an hour. Here is Andreas Voss.
Okay, seeing the people in the room, I was tempted to start my talk with dear family and friends, because that's about what's here, because there's great stuff otherwise going around. Let's go right away. I have no disclosures with regard to this talk. And as we're all aware of, there is a rise of superbugs. And I love to bring up the slide of Jim O'Neill's group, who the review about 10 million deaths due to AMR in 2020. And then there, of course, are people who will tell you that that is not true. And it pains me to say that in this he might be even right. Now I have no, I'm sorry, I put up the slide of Trump and automatically the microphone is gone. This is, I feel like I'm politically censored here.
As the moderator, I just simply have to say there might be Republicans sitting here, so you never know.
Okay. Here we are back. So I will not mention Trump again because then I'll get shut off again. But it pains me to say that probably in this case he's actually even right, but it wasn't him saying that, it was Stefan Habar, and I apologize for putting those 2 people in one slide. So sorry for that, Stefan, I will not do that again. Anyway, so that is probably fake news, but it made obviously the news. And to do something, we need to be better in basic infection control, in antimicrobial stewardship, better surveillance, and technology. And better surveillance is the talk, or the topic of my talk, or I was also known as different surveillance, well, because there could be lots of discussion if it's actually better. So what's about using social media? If you look into social media, cell phones, and other ways of communication modes, it's kind of an open 2-way street. Number one, you're supplying a portal for delivering information to the public, which is an important thing, but on the other way, it's a channel by which people reveal their concerns, locations, physical movements, and probably far more information than they're aware of are wanting to share. So it's a 2-way street. And if you look into social media tools, and then how do you define it, one of the first one that looked into infectious disease surveillance was HealthMap, which was a great thing. And then you can see here the map with 925 alerts, but it has special alerts. You can click on them. So if you're interested in legionnaires' disease, there's one outbreak presently around the world, which would be interesting for you to look at. But it gives you information more than it really is a real surveillance. It has amazing sources, because from ProMed and WHO and the animal data and Eurosurveillance and Chinese news, everything is in there. But again, It's more like a collecting device of news and then presenting it in a nice way than that it is real, what I would call real surveillance. Still, I felt like we are in Switzerland at the present time, so I looked up what's the problem in Switzerland. And so I will suggest for all of you in the audience, stay away from Aargau or wear a mask because they have a little TB problem there. So I don't know how really helpful that is. The other thing is I wanted to try it on myself. Last week I had food poisoning, and it was clearly food poisoning. Like 4 out of 9 members of my group after a fun dinner got sick the next day. And so I looked up food poisoning in the Netherlands, no success. Obviously we were the only one, or no one reported it, as we of course didn't do. Anyway, this device is a collecting source. It's mainly alert, it's non-predictive, it's non-real-time, so it's not what we want. So how can we use social media to actually predict the future? And that's what it's all about. And there are people who say that social media can predict events, like Facebook thinks that can predict who is a liberal, who is a conservative, or at least map it from all that you and others left on the sites. Facebook can also predict if there's a breakup, if your love will end very, very soon, so there might be another thing there. And last but not least, Instagram pictures can be used to predict if there are markers of depression. So I thought if you're able to predict attitudes, depression, and breakups, why not outbreaks and emerging infectious disease? Makes to me far more sense than my love life. I didn't want to say that. I do not want anyone to tell my wife, which I dearly love, of course. Anyway, the first publication on dynamic data on flu was from Google. So detecting influenza epidemics using search engine query data. And it worked really well, I have to say. And at least in my opinion, it worked really well because they were about 2 weeks faster with any flu epidemic and season than our national surveillance system. But obviously people at Google were not thinking that they had accurate data. And the same thing holds true for Google dengue trends. So they stopped them both because they think they are prone to too many mistakes, and Jason probably could comment far better on that than I will. And to just give you an example why social media sometimes can be dreadful to be used when you Google flu or you use those search words is when Rihanna, the singer, announced that she had the flu, millions of followers were immediately talking about flu, and thereby you get completely screwed data, and it has nothing to do with there's a flu outbreak. There was just the right person starting to talk about it. So that's, I think, is a good example. It might be a little bit better if you use something like Flu Near You, which is an iPhone app. This is user input. But the problem is, do you ever reach enough people putting input into those apps to actually get a good capture of the area where you live in? So that would be fully dependent if all of us would get up every morning, open the 7 favorite apps to put in how we feel this day, and if we feel sick or not, then it might work, but I have doubts about it. But they try, and the same people who actually created HealthMap. So there are several studies using Twitter to predict influenza-like sickness, and again, they had about the same idea. When they looked at the Twitter contact, they were able to predict an outbreak of flu 1 to 2 weeks ahead of CDC's surveillance system. Sorry. So obviously, to a certain degree, that is possible. And then there is Cousteau, which is one of the devices. It was in my university. Actually, I'm the one paying it from my research fund. But it's a company that delivers all Twitter data from the Netherlands and Belgium, and it will tell you exactly the emotions with those tweets. And you have a nice machine that will tell you anything, any question you would like to answer. And it was used in the past to predict weather, snow in the Netherlands. Not a very common occurrence, I can tell you. But so they were trying to predict snow. And actually, you could create heat maps where you have real-time information of where you have snow and where you're in danger of a slippery road.
I can't resist saying that heat maps for snow is a bit odd.
Yeah, that's a good one. So I will, as of now, I will call it the cold map. But so we could do that. So I thought, why don't I use it to predict MRSA outbreaks, which I'm far more interested in. So we set that up to social media post online search behavior for early warning system for MRSA outbreaks. And the nice thing is what's in the Netherlands, you have those black bars here, which indicate we have mandatory reporting for MRSA. We know exactly where and when there is an outbreak of MRSA. So we could use the Google Trends data, the Cousteau data, to compare them to a gold standard of how many outbreaks there actually are. And in the end, for Google Trends, we found out that we need at least 10 posts a day. Sorry, for Cousteau. We decided at least 10 posts a day to say this might be a hit. And you can see it more clearly in a little picture like that. This is our search criteria. And you can see here in that wave that, thank you very much, that we hit over the 10 in this area and here on Monday, 21st of November. And when you look at the database from, it was usually 2 to 3 days before it was officially reported. And you can see that actually the start here and here, the start of the Twitter wave was far earlier. So you are able to predict something, but you're not predicting that it's coming. You just know earlier that it actually is there. So that's a kind of a Al Gore prediction, kind of. Then the problem is that there is, in our system, there was very little added value for MRSA outbreaks because they're all mentioned already, at least for the hospitals. We had a good outcome for nursing homes because they, at that time, were not reporting to that mandatory system. So we detected 16 nursing homes in the Netherlands that had problems with MRSA that were not known to the public before. And, but it's questionable if you could use the same system for a country with a high prevalence of MRSA. I have to say that too. So Candida auris is another one of those, a lot of people are interested in this, and so we wanted to explore, can we use Google Trends and others to find out more about Candida auris, and we used all the advanced options in Google Trends. First thing you need to do is create your standard, which you're going to compare it to. So we did a review, which we published separately, on where is Candida auris. We also used all our connections in mycology. Nijmegen is very well known for mycology. We have a huge network of KOLs that helped us to establish that. And then you get all the data over time, and you get 1,000 hits from which we clustered all kind of ways, by months, by weeks, by years, by country, and we're trying to make sense out of it, and it was extremely difficult, I should say. In the end, we kept it to this kind of a table, where the literature was positive. The first column is literature positive and Google Trends positive, and these were all the countries that were well known of having it, so it was no big surprise. We found those countries, 1/3 of the hits found countries that were known to have Candida auris, and we also found it in the social media. But unfortunately, the second column is where we know that Candida auris is present, but we could not find the social media presence of it. And it might have to do with the country, Bangladesh, China, Kuwait, Malaysia. I don't know how the Twitter people are there in those countries. It might have to do with how well informed people are there. If the government is extremely open about it and everyone is talking about it, there might be no need to put it on Twitter. But it was 1/3 that we missed. And last but not least, we had the unknown to the literature, and we couldn't even get the KOLs to know what there is. So those cases, 1/3 was Google Trends showed, like for a period of a month or two, that one country had the highest input. And for Australia, I should say, in the end, it was correct, because at that time no one knew it, but a month later we found out that they actually had cases. But for all the other countries, we really don't know why. This is probably just people being interested in a trending topic, then we can use it. So our conclusion from this was that it cannot be concluded that Google Trends searches currently do generally coincide with Candida auris cases. So there's still more work to do, and I know I have 5 minutes, like ending with the cons and the pros. The cons of using social media in this way to create dashboards of how things surveillance is going is you need special expertise to build those dashboards, and it costs quite a little bit. They are biased by VIPs reporting disease, by discussion groups that suddenly add activity, by public interest or non-interest in certain topics, by communication strategies of healthcare institutions and mandatory reporting within countries, and probably also by the prevalence of the event, because it is so rare occurring, you will never get enough tweets. It's also the availability of real-time data to build a dashboard in Google Fluid, and the privacy and ethics, because obviously we could go far further. Like telephone use in itself already could be used in models to predict disease, because when you're sick, you're probably not using it as much. My kids always use it, sick or not. But the prey is after initial build time, you save a lot of man hours, or women hours, I should say, because it's really automated, it's 24/7. It gives, I strongly believe that there will be extra possibilities will come with technology development and additional, maybe new social media that might still come, we don't know of at the present time. New health apps where people will enter data or get automated data, that certainly will be a source for more information, including surveillance. So with that, thank you very much. I hope that my last prediction is social media dashboards might not be fully replacing present surveillance, but will be part of real-time infectious disease surveillance in the near future. And if you said, I can't be serious, but I really are. Thank you very much.
All right, we have a few minutes to open up the floor to any questions.
I have a question, which is, you used Google searches. Did that surprise somebody who saw that the title was social media? Nobody was surprised. I was. Did you use Google searching as a substitute because you couldn't find anything on the main social media platforms?
We tried with some, but the nice thing is now we could have a little discussion what you call social media and internet behavior. So we use Google Trends to do that. So we do the Google search, but Google Trends. And yeah, I consider any kind of electronic information giving me information about what people think or do and what's just in the outside, I consider social media. But I might be wrong. The experts are sitting there.
Well, when you start looking at how the false positives occur, you realize that it usually has something to do with either a news article that just came out or a major social media influencer has somehow mentioned that particular term, like Justin Bieber and the 99.9%. So if you're sort of trying to find a way to be able to do predictive value through social media, you might need to be able to account for news items and media accounts that have high followings, because they may be confounding and possibly even taking over the results.
Yeah.
I would say that Twitter in particular is known for giving on-the-spot information. If there's a sudden outbreak of something, Twitter can be faster than Google.
Yeah, we did both, huh? Just to be sure that you don't misunderstand. We used Cousteau to evaluate Twitter, and we used Google Trends to do that. We tried to put Candida auris through Cousteau to find out the Twitter, but Cousteau at the present time is only doing Benelux countries, and you have to buy other content from otherwhere, which is extremely expensive, and we had very little success within our own country, so I decided to not buy that.
I've got one second.
All the way in the back?
Sorry. I did research 10 years ago during the swine flu year, 2009, looking at Twitter. And I'm a computer scientist by background, so we actually use real Twitter data and analyze them themselves. And I think this is kind of the way forward, relying on existing sort of black boxes like Google Trends is kind of detaching you from the real data sets and not giving the experts the kind of analysis power.
No,
So I think like in the future should really look into using things like Twitter or other social media, but actually using the raw data. What do you think about that?
Yeah, no, I couldn't hear all of it due to a very strange echo. But if it's about Twitter, I think Twitter is great. I only tried Twitter with VRE or something else. The search programs you use, they bring you every single word with VRE in it. With flu, somehow, it's extremely working the best, let's say it this way. But with everything else, it's really, really difficult. And I believe that other social media, like I had a reason why I showed the one picture of Instagram and depression. All my kids, they hardly ever tweet anymore, but they're taking thousands of pictures. And being able to evaluate those pictures will be a future help to actually look into it, because they will predict or they will show disease in some kind. But I couldn't really quite hear your question. Did anyone else do?
I believe she just said that with Twitter she had access to raw data versus Google Trends being a black box.
Yeah, that's true. Yeah, that is the main problem with Google Trends. And for all those who look really well, when you go to Google Flu Trends and you look up why it's not working anymore, then you find the message I put on the slide, and it says there, for all researchers and want to get in contact with Google, click the link. I clicked the link multiple times and asked for help. And I've asked people that are from Radboud Reshape that are really well connected. You don't get the help at the present time, or we didn't.
One question. Just now I finished my presentations on WhatsApp there regarding WhatsApp, because developing world docs believe more of WhatsApp rather than they're active in Twitter or active in other mode. What about WhatsApp?
As far as I know, that's encrypted data you're not getting easily from out of there. That's why all the criminals in my country use it. But
Okay, folks.
All right, we're going to end there, and I'm going to pass it on now to John to introduce Eli.
Okay, thanks, Jason. It is my privilege to introduce Eli Perencevic, who I think it's fair to say is uniquely placed to give us this talk. He's from the University of Iowa, and he is also an expert researcher. So, Eli, we're looking forward to hearing about the pros and cons of social media, the researcher perspective.
Thank you, John, and thank you, everybody. Good afternoon. I only got about 2 hours sleep last night. I'm a little jet-lagged, and so when I moderated earlier today, I stumbled over titles of talks, so I apologize if I do that here as well. So I have no disclosures related to this, no conflicts to disclose related to this talk. Instead of pros and cons, I think I want to focus mostly on do's and don'ts. I think there are cons, like don't spend too much time on it, but I think that relates to everything, email alerts, any sort of app on your phone in general. But other than that, I don't think there's specific cons to social media other than time. So I want to go through a little bit of a communication history, and then talk more specifically about how we can use social media as a tool to disseminate our research and our science and our prevention strategies and share in a way, and then discover new science. So it's a two-way street. If I'm tweeting and someone else is tweeting and we're reading each other's tweets, we're learning from each other. And then I think really uniquely what I've appreciated the past 5 years is how we can use Twitter and other social media platforms for advocacy and advancing causes. I have a specific example that relates to academics. So of course, social media is just another communication tool. We all know kind of many of these: cave drawings, newspapers, telephones. And I guess that someone probably gave a pro-con talk of telephones back in the day. But these are just tools, and so how we use them is important. And just a little bit of this. Twitter, social media, is just a propaganda mechanism, the way to sell, in a positive way anyway, a positive way to sell our science. And so propaganda, at least historically, a famous example is the printing press and how the Reformation and the Counter-Reformation utilized those. So this is exactly what's happened 500 years ago. And social media is very similar in that way. And of course, I don't want to talk about politics or fake news or anything, but social media is a tool that we can use to spread infection control and stewardship propaganda in a positive way. So this is kind of the earliest story around infection control. 150 years ago, a young, smart, and admittedly brass physician took a new position in a famous European hospital. He quickly became dismayed at the unacceptable high mortality rate, and after carefully considering many possible causes of deaths, he proposed a relatively simple solution by implementing his idea. He demonstrated a dramatic decrease in mortality. He then attempted to spread his ideas and implement his simple solution elsewhere, but was mostly ignored, ridiculed, and rejected. Defenders of the status quo forced him from his job. He confirmed his findings at a different hospital in a different European city, but practice elsewhere continued as before. His behavior became increasingly erratic, and he died at 47 in an insane asylum. And of course, we know who that was. That was Ignaz Semmelweis. And I think there are potentially, there are many reasons why he was unsuccessful initially. But he failed to follow up his results. He never finished his experiments. I think most importantly, he waited 14 years to publish his results. I think that's one of the main reasons. So if we don't publish our results and sell our science, if he didn't have social media, then you can't expect to change behavior. And additionally, and I think this is one of these don'ts with social media, he wasn't very nice. If you disagreed with Semmelweis, he sent you notes like, "You, Herr Professor, have been a partner in this massacre. I declare before God and the world that you are a murderer." And so I think the first recommendation, and I think these are the earliest tweets, by the way, related to infection control, even though they weren't on Twitter. But the first recommendation is to be nice. So if you're on Twitter, try to be as nice as possible. You can disagree, but be nice. And of course, if you publish your findings, but no one reads them, then how effective is that? And I think this is a cautionary tale of where we are in scientific medicine these days. So there are over 5,100 journals published annually. Total in Medline, there are 24 million citations, and that's about 800,000 per year or more. And if you look at that, your one study is, even in a day, is only 0.05% of all studies published per day. So no one can possibly read that many studies. Why should they even read your study if you don't tell them about it? So you can publish, but it doesn't matter if no one reads it. And so social media, I think there's people brought up other platforms. There's YouTube, Facebook, et cetera. And so that, this is where everyone is. Most people are on Facebook, and this isn't just scientists, it's all in the US. Many are on YouTube, and lesser numbers are on Twitter, et cetera. But what is everyone using? And so this is a few years old, but I think it still holds true. This was published in Nature about 5 years ago. When they looked at how people were using this, Facebook was largely used not for professional use. It's grandmothers posting their photos, or the parents for the grandkids to look at. But Twitter specifically was much more of an active platform for scientists sharing their science, reading and discovering peers, et cetera. So if you want to learn more, I don't have time in the 15 minutes to go with how to tweet. I think most of you raised your hands and said you're on social media. Maybe you're not on Twitter, but Debbie Goff published this wonderful review with Jason Newland and Ravina Kular a few years ago about how Twitter should be used specifically by ID physicians, but applies to all of us. I won't go through the step by step, but how to join Twitter is in there. And I think if you follow these instructions, you will end up in their table 3, and I've updated this slightly, but you can see that one of our moderators here, John Otter, was on this, and he's now up to 5,000 followers. And Didier Pate also has 6,300 followers. So some of the leaders of the conference and here at this session are very active on Twitter. So how should we use Twitter? And I've hinted at this. I use Twitter to stay up on the latest publications, follow colleagues in the field, be social in a way, share activities like what we're doing right now, post the latest articles, and I think importantly it's social media, and I think people that are successful in getting followers, being followed, and sharing their science are those that also share others' science. So it's important to retweet particularly, and also favorite colleagues' tweets, and they will return the favor. I also have used Twitter in the past to actually join infectious disease journal clubs, and also follow along at scientific meetings, both when I'm here, so you can look at the ICPIC 2019 hashtag and see all the people in the Candida auris session right now, But also when I'm not at a meeting, I can still follow along. So if there's a particular session a colleague's presenting at that you want to follow, you can pretty easily follow online. So if you're tweeting at a conference, I wanted to highlight a couple cool papers quickly. What makes a tweet fly? So what makes it be shared here? And this is one of the kind of earliest studies in this area that looked at 4 conferences on ID or IPC in 2016. John Otter was one of the co-authors. They analyzed 24,000 tweets related to 4 congresses, and they predicted what would be a retweet, logistic regression, yes, no. And they found that if you included a web link in your tweet, that increased the odds of a retweet by 2. And if you mention specific topics like C. diff or the media, that also increases sharing. And somewhat surprisingly, including a picture reduced the retweets. But this isn't typically what's known about Twitter, but at least with these conferences. How do scientists and physicians use Twitter at ECCMID? And so it's another paper from, actually it's just in press right now at CMI. And they predicted retweet success at those 2 ECCMIDs and showed that if you include multimedia or actually include other users' accounts, so you can tag someone by putting their Twitter handle in it, that increased sharing no matter if you were had a high number of followers or low. And also if you included a URL or hashtag, that was occasionally increased sharing. And I just wanted to highlight this too. If we're selling our science beyond here, this is a patient-centered symposium, how does that fit in with Twitter? And this paper from last year looked at scientists and found that the in-reach usually occurred, that's only sharing kind of within this group. So only other people attending ICPIC or other ID or infection control physicians occurred when you had less than 1,000 followers. But as soon as you reached a threshold of 1,000 followers, then you had a lot more outreach to the public, the media, et cetera. And it takes a while to build up that many followers, so, but once you do, you find that you're sharing outside of your bubble. So one quick example, me personally, how I sell some science, and it actually relates directly to ICPIC. So at the 2011 ICPIC, I think that was one of the first ones, if not the first one, I had a study that we did and we presented here in an abstract, and it basically measured the burden of disease and NIH funding, specifically NIAID funding in the United States. And we showed that there was almost no funding for things like MRSA and C. diff by the NIH at that time. And so we wanted to publish this, and we talked to Andreas Voss, who's unfortunately left, and he was starting a new journal. So he said, oh, publish it in my new journal. So this article actually was one of the first 3 publications ever published in antimicrobial resistance infection control, a journal at that time that no one's heard of. So you should probably never do that, because no one will read your paper because no one knows the journal exists. And it was it's an open access e-journal, you're not going to get it in your mailbox. So how could I sell the science? I actually used to blog for about 10 years, and so I blogged about it, I tweeted about it, and it got some attention that way. And just to show you, that article that was one of the first ever, a journal no one actually heard about at the time, has over 10,000 reads for a paper, 5 citations, and as an alt metric of 44. Now this isn't rocket, it's not the hugest read paper, but for something, it's in the 97th percentile, not in the top. But still pretty amazing for a journal no one's ever heard of. And it actually led to a blog post by Maren McKenna, pretty famous science journalist who wrote Superbug and I think Big Chicken about antibiotic use in animals. And she put it on her Wired blog, and it got even more attention. And because of this little paper that no one read, but there was a blog post, I was actually invited to be on National Public Radio in the United States to talk about it around the NIH outbreak. Why are we having outbreaks? And I got to say, because we don't fund AMR research. And who knows, but I think this kind of contributes to, in 2016, there's actually more funding now. My one little paper didn't do that, but all of us together in media, social media, making a case for more funding for AMR can actually happen. So not a direct link, I'm not claiming credit. So in the last kind of couple minutes here, as far as advocacy, I think it's really important to think about other issues that we have as academics, and one of them is equity, especially among female physicians. Many of them are underpaid, underappreciated, et cetera. And so it's a wonderful post on social media and advancement of women in the New England Journal earlier last year. And many of the things they brought up, just kind of give you an overview, they talked a lot about how social media can really bring out ways to acknowledge work-life balance. One of the things unique about social media is you can connect with people 24/7. So if you have odd hours because you're raising a family, both men and women really, you can connect at all hours. A lot of issues around gender parity get a lot of attention, including compensation, promotion, and manels. So there's no manel here. We have female speakers and female moderators, but that's something that used to be more common, and because of social media, it's becoming, fortunately, much less common because you'll get called out and chastised. It's also a place to identify virtual role models or identify mentors, and also build virtual communities to deal with things like burnout and sexual harassment. And a quick example here is a very famous hashtag that happened. This Heather Logie published, just tweeted one thing. There's an I look like a surgeon, I look like an engineer kind of hashtag that was around, and she said, I want an I look like the surgeon hashtag. And it went incredibly viral across the world, where people were posting pictures of all these female surgeons saying, I look like a surgeon, led to a New Yorker cover, et cetera. So you can really increase awareness around these topics. And I just want to thank the folks that helped me over the years. I've given a couple of these talks, and so these folks here, John Otter, Preeti Mulani, Debbie Goff, and Carlos Del Rio, helped me prepare this talk. So thank them. And then just in conclusion, I think we can all agree you should publish your science. Don't be like Semmelweis and wait 14 years. And you should use social media to sell your science. And of course, we should be nice no matter what we do. And you should use social media and all things you have access to advocate for equity, infection control, and antimicrobial stewardship, and also sell ICPIC 2019. So thank you very much.
Yeah.
So thank you, Eli. That was fantastic. I love the idea of using social media as advocacy for equity. That's a really nice theme. Does anyone have any questions for Eli? Whilst you're thinking about that, I don't want to be negative, but I wonder whether you could share any potential pitfalls and how we could avoid them.
So I think the major pitfall is time. And so I think one of the things we're learning is how we become addicted to phones. Like I left mine over there and I'm feeling that it's distant from me. It's like a baby or something.
It's been going non-stop, I tell you.
Yeah. So, but I think one of the things is to actually practice phone hygiene. Turn off all alerts to your phone, including Twitter. I don't even have the Twitter app on my phone because I don't want alerts that someone's tweeted. I have to go to the web browser and use it that way. So I think you need to actually practice kind of hygiene from these e-devices that we're all outside staring at. I think that's one of the biggest downsides is time. Typically, unless I'm at a conference, I only tweet or even look when I'm walking to and from work. So try to kind of stick with that, but I think that's the biggest risk. Okay. Thank you very much.
Oh, actually, I was going to ask you, I was just going to relay one thing. How many people here have ever heard of a TV show called The Resident? It's a pretty famous show in America. The executive producer, Amy Holden-Jones, and I get along extremely well. She wouldn't have known who I was if it wasn't for using Twitter and working in the social media, sharing papers, sharing information, and sharing stories. So a couple of the episodes that are coming up in season 3 are actually due to the fact that I brought some ideas up to her, and she was like, I'm on it, we're going to put that into the script. So just to give you an idea of what the power is of social media, if you do it right, and you do it effectively, and you do it neutrally and friendly, just as Eli was saying, you might be able to get even the biggest names to pay attention.
Thank you. Very good point.
Thank you. In the social media presentations that we have heard so far, we haven't heard of one organization. It's a company called Sympler, S-Y-M-P-L-U-R. How many of you know it? So Simpler created, probably nearly 10 years ago, a hashtag directory for tweet chats and another one for conferences. I can pull that together with the fact that this is a patient-included conference, because it was in fact Vanessa Carter who enrolled ICPIC 2019 hashtag onto Simpler. So you can go onto this SYMPLUR and see the history of it, or how many tweets have been emitted, who are amongst the people who've tweeted the most, and the influencers. So I recommend any event that you're organizing, you create a hashtag in advance, you let all the speakers and the participants who might have accounts know about it, and encourage them to tweet out photos and information and papers, for example, the live stream here, and put that through Simpler. I myself have 2 accounts, one with 10,000, one with over 19,000, and it has equally created many professional opportunities to work with Professor Pité, for one. So I'm now going to invite Julie Storr, who has a fantastic healthcare background as a nurse in infection control. She works in global health, and it's really great that she's concentrated on YouTube, because you may know that after Google, and Google is their owner, this is the second most used search engine in the world. People now go to video to find things, to find information.
Thank you. Thanks for that introduction. So the final part of this session, and thank you for staying with it. So the title of this talk is a question, and it's, do YouTube videos focused on infection prevention work? And before I start, just some kind of disclosures. So I am on the steering group of an entity called Healthcare Information for All, which is it's like a movement that's trying to lobby for access by all healthcare people and all people of the world to reliable evidence-based information, which is, I thought, a little bit relevant to this. But back to the question, I always find it fascinating when a session at a conference starts with a question, because actually it could be quite a short session, couldn't it? If my next slide says yes, and I just walk away. I'm not going to do that. So my answer actually is, and I'm sure it doesn't surprise people, that it depends. And it depends what we mean by work, because do we mean, you know, if you put a video on YouTube around an infection prevention and control issue, will it actually impact on what we strive for in this specialty, which is to impact on behavior and outcomes? Do we mean, does it work in terms of heightening advocacy around IPC, infection prevention and control? Do we mean, is it going to help with some of those issues around spreading facts and dispelling myths? Or do we just simply mean, does it work because it gets traction? Because you put something on YouTube and more people will see it. Is that an outcome in itself? Or do we mean, does it work because it fulfills the goals of both education and entertainment? This term edutainment, which I'm sure many of you are already familiar with. So what we do know, for starters, for sure, is that YouTube is used widely in global health, and including by the World Health Organization. So you would infer from that fact that it probably does work and does serve its purpose. But I'm going to drill into that a little bit more. And there are a number of entities. I've just drawn out a few here that I'm familiar with most, and of course one is World Health Organization, where I've spent a lot of work time. The other is Medical Aid Films, some of you will be familiar with, and Global Health Media. Each of those have YouTube channels and use that as a medium to disseminate their informational products. So Global Health Media, if you've never seen this video and you want to sort of get a feel for the power of YouTube for healthcare information that is related a little bit to our specialty, the story of cholera is a good place to start. And they worked with a leading Japanese animator to develop a very short, compelling film about cholera and to raise public awareness. And that's received, as you can see, 12 million views. So in terms of pure reach, that's probably worked. The good thing about these two organizations is they actually do a lot of research into the impact of their videos as well. Medical aid films, we've worked with at WHO. This is actually their top-rated, top-ranked, most popular downloaded or watched video, and it's about clean delivery, safe delivery, 1.6 million views. And then the WHO's #1 viewed video on its YouTube channel, which again, some of you may be familiar with, it's used repeatedly every year since its development, is addressing the subject of depression. And again, if you've never seen it, it's really short, it's very powerful, and it kind of inspires you how to develop a compelling content. And that's had 9 million views, which for WHO is a lot. WHO, the World Health Organization, really constantly is striving to be the go-to source of healthcare information, and it is frustrated, I think, fair to say at times, because often people will use Google. YouTube is the second most popular, but often people won't go to WHO, they would go to Google first. So in the WHO IPC team, again, many of you will know, to supplement and complement the guidelines, use of YouTube videos is used on the WHO YouTube channel to help disseminate, to help educate. The IPC unit haven't gone down that route of edutainment as yet, but maybe in the future they will. And so why was I interested in this topic? And I'm going to share in a few moments a paper that I worked on addressing this issue, which I think is why I was invited up here in the first place. But my interest really goes back a long way, and it goes back actually to the last century, to 1999. And this was 6 years before YouTube launched. YouTube's been around since 2005. And this goes back to Oxford in the UK, and some work that I was involved with Dr. Mary-Ann McGuckin, who you can see is presenting tomorrow. She's a powerful and was one of the early drivers of patient involvement in healthcare-associated infection. She's done a huge amount of work in this area and inspired me back in '99 to really consider working closely and collaboratively with patients to try and improve hand hygiene, and that's something that's stayed with me ever since. Now, the reason I tell this story is because it is kind of about healthcare information, and it kind of tells you a little bit about my thoughts and feelings on this matter. So one of the things we did in Oxford was we visited all patients on a ward that we were undertaking this study. We talked to the patient, we asked them a few questions about their knowledge around healthcare infections. We provided them with some information in the form of a leaflet. This was before really the internet was widely used. And because we were replicating a study that Mary-Ann had undertaken first at Pennsylvania, in that study, she had used what she called fuzzy weebles, which I had, at that point, I admit, I had no knowledge what a fuzzy weeble is, but it's this little furry thing, usually with eyes, and a tail on which you write some sort of information. And in this instance, Mary-Ann wanted to give these out to patients, and the tail would say, "Have you cleaned your hands?" So it was about reminders in the workplace, working collaboratively with patients and asking them to use these fuzzy weebles. And I had antibodies to this idea. I really felt that this wasn't right to use something that to me kind of infantilized what we were trying to achieve. But she did persuade me to use them, and 20 years later, I've been on this journey of considering the benefits, the impact, the ethics of the healthcare information that we develop. And I do see this now more and more as an ethical equity issue that I think has been mentioned by some of the audience, and this is why I'm involved in this entity called Healthcare Information for All. Anyway, very rapidly I want to go through in the next moments some of the evidence. This is a really strongly growing and developing field. So even today, I'm sure that there's been more written on this subject, but just pulling out a few of the papers that will be referenced at the end of this talk. So as Denise said, YouTube is the most popular, freely available, easy-to-use, internet-based video platform. And it's the second most visited site worldwide. And there's a really nice paper by Bora and colleagues on that matter. And it's emerged as a really strong source of healthcare information for the public, and it bypasses traditional sources like TV, like radio, like the press, and conferences and lectures in many instances. Information provided in the form of videos has huge advantages and is seen as potentially appealing, and I think that's why many in our specialty have gone down this route of using video and YouTube as a platform to convey messages on IPC. And particularly if you look in the literature, there's been a lot published around the use of YouTube during epidemics. 4 or 5 years ago, during the Ebola outbreak in West Africa, in the Zika outbreak a few years ago, there's a huge surge in viewer traffic of YouTube videos related to the topics of Ebola and to Zika. And I'm sure you can think of other examples. And so what could worry you in one respect is if the content of those videos is wrong or misleading or ambiguous, then misinformation potentially can spread like wildfire, and that's counter to what we want in our infection prevention and control specialty. And again, I just put this slide in to show some quite recent data from Marianne McGuckin and colleagues, which she's done, and she's replicated this in different countries, but it kind of gives you a feel that the use of social media is used by the public, use of web searches is used. So we've got, even from our specialty, where people go to look for information on HAI, it's already come across from some of the speakers already, but there's a lot out there that gives us some really solid information. So the Borough paper that I mentioned was focused on Zika, and I just draw out a couple of things here. What this paper tells us is that 25% of the YouTube videos that they looked at during that Zika outbreak were what experts would consider misleading, and that unfortunately those were more popular than more informational videos, and their concern therefore was this spread of misinformation. What they also found in their study was videos from trustworthy sources like universities and health organizations were scarce at that time from what they could find during that period. So then we're moving closer to my particular area of interest and the research that I was involved with a couple of years ago, this issue of education and entertainment, edutainment. And essentially it's the use of videos, TV programs, other material in a fun, enjoyable way to convey serious messages. And Hugo Sachs, Lauren Clack and colleagues have very recently published in Antimicrobial Resistance and Infection Control, again, a nice study if you're interested in looking at some of the depth of this. And those of you who were at the last ICPIC may remember from the Innovation Academy, and I think the ICPIC Clip Awards, they actually submitted this video. It was a video version of an SOP on standard precautions. A nice short video using humor, using fun, to try to convey a serious message. And they did, they compared that with the effectiveness of a paper standard operating procedure. So they used, very humorous, lots of laughter, lots of strange, silly images in the video, based on that theory that use of edutainment can be a source of behavior change. Building on that, what we did a couple of years ago with colleagues back in the US who are not here today, unfortunately, but my colleagues Catherine Lim and Holly Seal and Claire, who is here, it was triggered by this interest and this explosion that we've seen in previous years of the use of YouTube for hand hygiene related videos. So this study was purely focused on YouTube videos that were about hand hygiene, that were intended to be educational, and we did both qualitative and quantitative analysis. I'll summarize the findings on the next slide. But a few things to say. One of the things that really concerned us, I suppose, was there was in many of the videos miscommunication about some of the fundamental evidence-based recommendations, such as 5 moments for hand hygiene. And that jumped out. But on the whole, we used, there's a whole checklist of criteria that we used to analyze the 70 videos that we finally got down to from a long list of 400. Looked at educational content, analyzed it for its persuasiveness, its educational evidence and accuracy. Just over half, 55.7%, scored as educationally useful. So that surprised me actually, but is a positive finding from this study. The highest scoring videos tended to be attractive, comprehensive, and persuasive. So I think just from this whirlwind tour of whether YouTube videos focused on IPC work, they certainly can be a great source of healthcare information. I think that's undoubted. I think we need to consider both the accuracy and the trustworthiness of the content. If any of you have been involved, and maybe many of you have, in developing videos that you will then post on a healthcare organization YouTube channel, how can you assure that that content is accurate, that it's trustworthy? And unless we do we need to consider in our specialty some sort of curation and authentication of YouTube videos? What the Bora study found was, and YouTube has been criticized for this in the past in terms of its algorithms, the most popular videos, most relevant videos, when you try and sort YouTube videos by relevance, often it skews it so that it's not the most accurate, and often sometimes it's very inaccurate information that they will rank. So the algorithms in YouTube don't support the accuracy and the credibility of the videos, which is concerning. And I think from our study, what we found was lacking, and what we would recommend moving forward was, if you're developing a video, join it up, make sure it's aligned with and in line with the guidelines on IPC, and use them during the development and undertake rigorous checks. I'd like to acknowledge a few colleagues and thank you all for your time.
So after hearing that, who thinks that they should produce more videos or use more videos? Who is now alerted to that? So this was a successful talk. And who thinks that unfortunately the cost of maybe producing something of quality and that would be attractive is a little bit of a barrier to them? Can you address that question?
What are my thoughts on that question? I think if you work for, if you're an infection preventionist or even an interested person in a big organization, then the power of persuasion in getting support for that from management is probably one route to take. Undoubtedly, I think as technology has increased, the actual cost, physically, we've all got extremely brilliant video cameras in our pockets most of the time. But the actual opportunity cost, I think, is something that bothered Claire and myself and was a concern initially. It was, so if people are developing these, how much time is it taking? And if they're developing them and they're not evaluating impact, what's the opportunity cost? So that's what I would say, not just financial, but the opportunity cost here.
Yes, the cost of not doing it and not getting your message out could be part of the argument. But I think also that one shouldn't hesitate to work with freelancers, with individuals, with students. Their ability, thanks to being able to Google, has so risen. You can find very young people with low costs who can take the content you want and you qualify and make something very interesting, and you can test them. Short videos that you throw out there and you see what takes, and then you go in that line instead of spending a lot of time to do something that's going to cost you many thousands of whatever your currency is, and then it doesn't work out right. Short is beautiful. So I want to thank you for a great talk on a very important topic, and I guess we've reached the end of this panorama of social media, which I think was very positive. You can take another breath as you leave the room to go to another session. Thank you.